Alright, Joanne. So based on our conversation, I now understand that there are several areas in which Concentra can provide a better solution to FedEx for your occupational health needs. Thank you for the information that you provided with me about your company and your current healthcare provider, which is BOAC. More importantly, your roles and your responsibilities here. I heard a few things that were causing you some frustration, so I'd like to address those. Before I go into a solution for your company, I now have a tool to help me guide you properly. I'd like to briefly share with you what you should expect from your provider. So what Concentra did was to say, hey Joanne, what do you look for when you're choosing an occupational health care provider? What's important to you? Concentra did some internal research and talked to industry experts like yourself to figure out what good looks like to all of you. We've reached out to the American Medical Association and the American College of Occupational Medicine. And what they told us, what you told us really, is that there's really 10 things that you should have, that you need to have an effective program for your provider. These 10 must-haves are what should be expected from any medical provider that you choose to go to. We created our own keys out of those 10 must-haves. Let me dig into those must-haves for you. So I saw 2 areas that you were missing. First, you mentioned that you don't receive any reports or paperwork from BOAC. This could affect you greatly because not having that communication can cause dramatic slowdown and inefficiencies in your company. Is that right? Then you mentioned that no one from BOAC has ever came to your work site to understand specific workplace conditions that may help inform treatment. By having a relationship with your employer, you'd be able to minimize lost time and reduce costs. So we took the must-haves and we created this. Based on our conversation, I'm hearing that you have some of these in place, your patient engagement seems to be okay, and the wait times are pretty quick. So we took these 10 must-haves and we created our own solution and broke it down into 4 keys. Those 4 keys are employer engagement, patient engagement, clear communications, and quality medical outcomes. Where I see that your biggest gap is clear communications between you, the employer, the employee, and the insurer. From what you told me, the doctor never calls you, so you have to use your own time to pick up the phone, leave messages to understand what's going on with your case. And you don't get the information you need in a timely manner to submit to your insurance company, which would include the clinician calling you right after an injured employee leaves, receiving your patient status reports and updates on your cases. If you don't have that, it's not really that helpful for you. Currently, your employer gets hurt on the job, and it's a hassle to get any significant information about the injury from anyone. That's probably not very efficient for your company. You also mentioned that no one has ever visited your work site to understand specific workplace conditions that may inform treatment plans and return to work transitions. Also, not having a professional evaluate your employees' day-to-day workload to make sure your workers are fully capable of lifting those heavy boxes every day, all day, was a concern of yours. Now what we did is we took this and we created our version of it, and this is how we solve those concerns for your employer. Our medical model is based off of what you as an employer needs to have a convenient and efficient provider ready at your fingertips. So based off what you're not receiving from your current provider, I feel that the 2 that are the most important that could benefit your company the most right now are employer engagement and clear communications. Employer engagement allows the medical staff to collaborate with the employer to develop occupational health plans tailored to the specific needs of your workforce and your workplace. So assessing your workplace for appropriate stay at work and return to work decisions is very beneficial for your company. The other key that would benefit your company dramatically is clear communications, or keeping everyone in the loop, you could say. Maintaining clear communications among clinicians, the patient, the employer, the insurer, the payer, everyone involved really drives good decisions about patient treatment as well as how to return to work. And do you see those keys solving the problems that we discussed that you were having? And do you see any reason why you wouldn't want to come in for a tour?